So some assessment pearls. A good assessment is proactive. Do you remember that graph I showed on the organ failure graph? You know, if you don't do a proactive assessment on those patients, you're way behind the ball. A good assessment acknowledges goals of care because you have to know what you're treating and what you're aiming for. A good assessment assesses the disease trajectory. We've talked about the disease trajectories, and the care of that patient is going to be very different depending on what trajectory you have. And I often have discussions with disease trajectories, especially in cancer care patients. Oh, I don't need to do a power of attorney at the moment, doctor, I'm feeling fine. Well, yes, that's great, and I'm really glad you are feeling fine, and I hope you carry on feeling that way for a long time. But with cancer, once things start going wrong, once the brown stuff hits the fan, it's going to happen quickly, and that's too late. Same with disease, with organ failure. So you need to know your trajectory before you can do your assessment. So it assesses the whole person and the family unit. And I use that word family in inverted commas because it's really the village that is gathered around that person. Standardized tools can support the practice and provide information. So if I get a phone call from a community care nurse who says, I'd like you to see Mr. X, I want you to see him now because I'm concerned about that he's going to go downhill quite fast. He's really aiming to die at home and he really wants some help with his control of symptoms, goal of care. He's got cancer and he's just starting to deteriorate, trajectory. His family are really worried about him, and I think they need a little bit of a talking to about feeding or over sedating, family unit. And his PPS is 30. That's a standardized tool, and I've done an ESAS on him, and that'll tell you what the symptoms are. And we'll talk about PPS and ESAS in a minute. So that's a good assessment, and it allows communication between professionals so that you can give consistent palliative care.